The quick way to describe what I'm doing is I'm studying poop. There are all these tiny microorganisms living in us, and basically they bring into this whole other genetic component that we don't have, and they're different between different individuals. And so we have this whole ecosystem, but we don't understand how it's able to have these effects on us, and I'd like to figure out how.
The relationship between diet and cancer, of course, is something that people have been interested in for as long as people have known about cancer. I happen to be a practicing oncologist, and I would say the number one question I get from my patients is, what should I eat? And I don't know, eat a heart healthy diet just doesn't feel like it's a good answer in 2022.
At first, we just thought that these microbes were important for nutrition. It's only the past few decades that we've learned that they're really important also for immunity. And so you can see how these two fields in parallel have come to the point now where we're realizing that gut microbiome has a big impact on cancer immunotherapy treatment.
Our digestive system is considered to be outside our body, and it has to sense the quality and quantity of what we eat. I'm particularly focusing on the molecule that sense those external stimuli, how they sense those stimuli, and how they send signals to the gut and also outside the gut. My research studied the serotonin system in the gut in a bit microscopic way. I'm hoping we will be able to specifically target the 5-HT receptors so that we can have more precise treatment for cancer-related pain.
About 5 years ago or so, some advances in technology made it possible to really measure nutrients available to tumors in a different way. And that led us and some others to really start thinking about, well, if we can look at how the food we eat controls what nutrients are available in the tumor, maybe we can inject a new way of rigor and thinking into how diet might interact with cancer. And that's, to me, is one of the more exciting directions in our understanding of cancer that we may see progress made in the coming years.
The great thing about the Damon Runyon is that they not only found the cancer-related research, they also found very basic research. I personally believe that always the basic science creates the breakthrough, and then that eventually contribute to the cancer research and treatment.
And the idea to study the metabolism of cancer is, it's a very old field, but it was not something that a lot of people did at the time. Damon Runyon funded me with a postdoctoral fellowship. I'm happy to say that I think that bet paid off.
The support from Damon Runyon helps me to be able to do the science that I'm doing. I have a tremendous amount of freedom to be able to explore these questions and to really tackle new ideas.
I feel like there's this renaissance in thinking differently.
We're going to hopefully be able to engineer gut microbes to be able to add an additional way of treating cancer. And you could think about oral administration of gut microbes, I think is probably the most powerful next step forward.
I think there's some really cool stuff on the horizon.